So this week I'm going to be releasing 3 videos on our skin as mothers, the changes that we go through and how best to look after our skin. The first will focus on pregnancy, then we will move on to postpartum skin, and then the skin of tired mothers like myself. So I'm going to start with pregnancy acne, and this is because it's something that I suffered with myself. Now, acne is often caused from a build-up of oil under the surface of the skin that's being blocked. So this could be blocked by a layer of dead skin, or at the moment people are suffering from maskne because we're wearing masks all the time and it's blocking our pores and stopping oil from being released. Now, in pregnancy, we have a surge of hormones and our hormones are constantly in flux. Now, progesterone is responsible for stimulating the sebaceous glands, and in pregnancy, these can go a little bit wild and produce too much oil. When too much oil is produced, obviously it needs to escape, and if it can't escape effectively, then it's going to build up with spots and acne. If this is not treated, then bacteria comes along and can spread the acne, and it can get quite nasty. Pregnancy is a little bit tough because we can't use all the ingredients that I want to prescribe for you. So for example, retinol is an excellent product to unclog pores because it resurfaces skin, but we can't use retinol because retinol is vitamin A, and as you all know, we should avoid high levels of vitamin A in pregnancy. And also salicylic acid cannot be used when pregnant or breastfeeding. Now, these 2 ingredients you can discuss with your GP and check that you are okay to use them, and I'm happy to work with patients on this kind of basis, but generally as a rule of thumb we should avoid salicylic acid and retinol. Can we do to treat acne in pregnancy? It's really frustrating. Exfoliation is key, and there are 2 types of exfoliators that we can use. A chemical exfoliator such as a lactic acid or a glycolic acid, and physical or manual exfoliators such as scrubs, brushes, or those Lumi devices, which I don't really like, by the way. I think that the Lumis can be quite harsh on the skin. They can remove too much of the good oils that are protecting your skin. But anyway, that's another matter. We can absolutely use lactic acid in our routine. So we can use a lactic acid cleanser or a toner, or what I really love is the Illumier AHA Renewal Serum. It's a 9% lactic acid serum, and it also contains hyaluronic acid, which is really hydrating too. So that's a really lovely, gentle exfoliator that will get rid of that top layer of skin. It's the top product that I recommend my patients that do have acne and cannot use the standard retinol or salicylic acid. Keeping skin hydrated is also vital because skin that does not have enough hydration in it will not desquamate properly. And what desquamation is it's the removal or the natural exfoliation of dead skin. So if your skin isn't able to remove its top layer of skin itself, just from brushing off or skin just flaking off into the air, then we're going to get a problem. So keeping skin hydrated means that the skin is naturally going to desquamate properly. Hyperpigmentation are dark patches or areas of the skin that are darker than others, and in pregnancy we generally call this melasma. And melasma means there is a hormonal cause of the hyperpigmentation, and obviously during pregnancy our hormones are going crazy. In our skin sit melanocyte cells, and these cells are responsible for producing melanin or pigment. Now, where there are clusters of these melanocytes, pigment can be released in clusters, resulting in patches of darkness on the skin. Now, darker skin types have more melanin in their skin and so are more susceptible to experiencing hyperpigmentation or melasma. So the kinds of ingredients that we use to target pigmentation, like kojic acid, glutathione, alpha-arbutin, cannot be used during pregnancy. Really frustrating. However, you wouldn't want to use them in pregnancy. Because your hormones are going to be constantly changing throughout your pregnancy and in the 6 to 12 months afterwards, it's kind of pointless to be treating it right now. What we should be doing now is preventing it and protecting your skin. So what we can do, 3 things. You can wear an SPF every day, even if it's the winter, even if you're staying inside, UVA can still travel through glass and trigger those melanocyte cells. So wearing a good SPF during the day is important. Don't sunbathe, it's not worth it. You might get a really good tan when you're pregnant, but to me it's not worth the risk of triggering melasma and causing a lot of damage that the UV does. So we can also wear wide brim hats too if we're going for walks in the sun. Finally, vitamin C we can use during pregnancy. So vitamin C is an antioxidant, so it will protect us from the free radical damage that UV is doing. It will also speed up the skin cell cycle, so it will get rid of some of the hyperpigmentation in your skin currently. And it's just a general all-round nice brightening ingredient to use. Once you are 6 months postpartum or have finished breastfeeding, then we can use some really exciting products. So we can use Illumier's Even Tone or IntelliBright to suppress the melanocytes, so to quieten them down, so when UV hits them, they're not stimulated and they don't produce melanin. And also some pigmentation lighteners that will actually lighten the skin. And then finally retinol that will resurface the skin and allow those pigmented cells to be pushed up and out of the skin surface quicker than usual. Thread veins or spider veins are little tiny veins that sit on the surface and generally appear on our legs. And I feel that some people are more bothered by these than others. Personally, I wasn't actually bothered by my thread veins when they first came up. It wasn't until I later trained in sclerotherapy, which is the treatment of thread veins, that I really notice them on myself and notice them on others too. Sclerotherapy is a treatment that you can have once you've had your baby. It just involves micro injections of a product called fibrovane that will collapse the vessel, and eventually the vessel just shrinks away and dies. Now, the reason we get thread veins during pregnancy is because of the increased blood volume in our bodies, because we're obviously pumping blood to ourselves and our babies. And secondly, the increased weight and pressure on our legs can push these out to the surface. If you're still watching, well done. Thank you for sticking with me. So in the next couple of days, I'm going to be posting a video on how the skin changes postpartum, because after you've had your baby, you might well find that your skin is a completely different kettle of fish, like it was for me. I look forward to seeing you then.